Hello students, welcome to Anaesthesia INI-CET recall session. Right? How did you wrote your examination? As usual, INI-CET paper generally carries slightly a different tone when compared to NEET PG entrance examination. So not many repeat MCQs are there, but they have a standard way of asking the questions, right? So this year in Anaesthesia, we got purely from Anaesthesia is around 2 questions and 1 question from the a typical trauma scenario or an emergency scenario. So without wasting much time, let us discuss what are the questions that have been asked in your entrance examination. So the first question, ketamine is used as an anesthetic agent. All of the following are advantages of using ketamine except A, it augments opioid analgesia, B, it reduces opioid tolerance, C, can be used as an induction agent, D, it produces dissociative anesthesia. So this is a pretty standard question. Those who are writing this INI-CET examination and those who have read anesthesia, so they all know that ketamine is a stimulant. Ketamine is always a stimulant. So what is this it do? It increases heart rate, it increases blood pressure, it increases everything. ICP, IOP, everything it increases, right? The unique point of ketamine, everyone knows, is dissociative anesthesia. What do you mean by dissociative anesthesia? Means patient will be wide awake, but he will not react to the pain. Most of the times patient they do complain of these dissociative state is completely an unpleasant state. Most of the patients they experience a sense of unpleasantness when they are given ketamine. That's the reason why generally we don't give ketamine alone, because this will create some sort of that psychological effect that is taken by the patients is not acceptable for each and every patient. So generally what we do is ketamine we always mix it with some other agent, right? It can be, most of the times it is mixed with midazolam. Why it is mixed with midazolam? The reason being is midazolam causes sedation, and with ketamine the dissociative state which is creating some sensation of unpleasant hallucinations, they can be taken care by this midazolam, right? Or some people we also add propofol. Again the same reason, propofol also has, we call it as ketofol, right? But we can use ketamine and propofol combination. Again propofol will cause some amount of sedation. Whatever the unpleasant sensation that is caused by this ketamine will be reduced by this propofol, right? So some students they said that ketamine is mixed with some other agent. Whatever might be the purpose, if you are mixing the purpose of it, then this is the whole content of it. So we don't know, this is a recall session, we don't know exactly what they are wanting to ask. But yes, if they have asked this question, ketamine is used as an anesthetic agent, especially induction agent. All of the following are advantages. It augments opioid analgesia. Yes, this is a true statement. So they are asking false statement, right? So it augments opioid analgesia. Ketamine is the only anesthetic agent, induction agent, which has got some amount of analgesic property. And I have shared a beautiful, experience that I have faced with the ketamine in the main videos also, right? So this ketamine can be used as a sole anesthetic for short duration procedures. Okay, so that's pretty advantage. You can give one drug, you can sit quietly and everything will be taken care. So that's not an exception, right? Right, it reduces opioid tolerance. Yes, that's the reason why last year also in INI-CET they have asked this question. Ketamine is one drug that is used, recently approved in treatment of chronic depression. Ketamine is one drug that is also used in treatment of opioid tolerance. So this is also one of the biggest advantage of it. So this is also a true statement, right? Can be used as an induction agent. Yes, ketamine is obviously classified as an induction agent. Especially this is indicated in patients who are hypotensive or in a shock situation. Most commonly asked question in your entrance examination. A person met with road traffic accident, lost 2 liters of the blood, posted for some emergency surgery. So obviously we have got 3 true answers, which is the last one. It produces dissociative anesthesia. As I said you, this is not an advantage. This is one thing which made ketamine to step back. Why? Because as I said you, many people they don't relish this feeling. There are some people who like this, but majority of the people they don't like this dissociative feeling, right? And most of the times, because it is a good analgesic, I can use it in post-operative period. But one of the disadvantage of ketamine is if I start infusing ketamine to you because of thinking that it's a good analgesic agent, it will cause dissociative effects also, unpleasant hallucinations. Okay, right? So that's the reason why this is not a beautiful advantage of ketamine. But yes, if I put ketamine at a very low dose, this can still be used as an analgesic also. So generally, all advantages of ketamine are there. I personally feel that creating a dissociative anesthesia is not an advantage of ketamine. That's the reason why we mix ketamine with some other agents like midazolam, propofol, etc. So getting a dissociated state is obviously not a good advantage of ketamine, right? So that's about the first question, ketamine, right? Coming to the second question, again, identify the nerve being blocked in the with local anesthesia in the procedure shown below. What is the nerve that is blocked? So some students, they recollected that the injection is pointing towards the molar near the hard palate. Okay, so this kind of questions typically INI-CET people will ask, because in 2023 also there was one question. They were asking something about anterior ethmoidal nerve block, something like that. So let us see the option. Obviously, even if you don't know what is nerve block, what nerve that is coming out, if you know where is that location, you can easily answer it. So can you see here, it's very close to this hard palate, right? So what can it be? So obviously it cannot be infraorbital. Infraorbital is obviously here, right? Infraorbital is not the correct option. Maxillary nerve, maxillary nerve is it? These are all the branches of the maxillary nerve, right? Maxillary nerve is one of the branch of trigeminal nerve, and maxillary nerve produces lot of branches. Anterior, middle alveolar nerve, posterior, superior alveolar nerve. Okay, it also produces palatine nerve, greater palatine nerve, nasopalatine nerve. So many branches it will produce. So maxillary nerve also we don't block it here. So maxillary nerve generally we block it suprazygomatically. So we generally use it maxillary nerve blockade here. Infraorbital is here. Okay, right? Anterior ethmoidal nerve, this is also not right, because this was asked in the last INI-CET exam. So anterior ethmoidal nerve is somewhere here. So let us quickly review rather than showing on my face. Let me show you how this trigeminal nerve is formed. So we all know in the anatomy, trigeminal nerve or the Gazerian ganglion is present on the the petrous part of that what is that called, Meckel's cave, right, on the middle cranial fossa, right? In that in the middle cranial fossa, it produces three branches. Can you see in this anatomy? The first one, it is ophthalmic division. Okay, the second one is the maxillary division, you can see here. Then the third one, so that's the reason why they say ophthalmic division, maxillary division and mandibular division, right? So this maxillary ophthalmic division, it comes out through supraorbital foramen, right? Through this supraorbital foramen it will come out. This maxillary division comes out through the skull through the infraorbital foramen, and the mandibular division, it comes out through the mental nerve foramen. Okay, very good. Right, now see here, what are the divisions of this maxillary branch? So let me show you one more picture, you can easily understand here. So this is how somewhere here is your trigeminal gang, that is in the middle cranial fossa. The Gazerian ganglion will be coming. So from there the branches are coming up below, etc. So there are different branches of it. Can you see here? This branch is called as zygomatic temporal branch of maxillary nerve. Okay, and this is zygomatico. I'll write it in different colors so that you will understand. So yeah, this is zygomatic facial nerve, right? Can you see here? This is posterior alveolar, and here is your anterior and middle alveolar. These are the commonly used blocks by the dentist. Okay, right? And this is coming out through this foramen. This is called infraorbital nerve. So infraorbital nerve is coming here. That is the reason why here is your supraorbital nerve. This is your, somewhere here is your supratrochlear. I will put it in black color so that you can see it. So here is your supratrochlear. If you know the anatomy, the nerve blocks are very easy. And somewhere here is your anterior ethmoidal. Okay, sir, where is this? What is the correct answer in this MCQ? Obviously, it is showing, near the palate. So what is the clear answer? The clear cut option is, even if you don't know the subject, you can easily answer it. That's the greater palatine. So where is this greater palatine now? See this. If you look at the inside of your hard palate, you can see very clearly in your anatomy, the greater palatine is coming from this region, right? And the nasopalatine, yes, here it is coming from this, in the anterior portion, it is nasopalatine, and in the posterior portion, it is greater palatine now, right? So greater palatine now. So all these nerves, it will be coming here. So what is the correct answer in this given MCQ? Greater palatine now. Right. So yes, some students, they said, sir, infraorbital, most of the undergraduates, they have not said, but postgraduates, they said, yes, infraorbital can also be approached. Infraorbital, now, generally what we do is supraorbital, I will put it here. Most of the times I do it like this only. I'll put it here. Infraorbital, I will put it here. And infraorbital is very beautiful nerve block for cleft lip surgeries. Okay, sir, they said, some of the postgraduate students, they said to me, sir, infraorbital can also be blocked intraorally also. Yes, you can block it intraorally, but we'll not put it very close to this third molar. We'll put it somewhere here. Okay, so in the front portion only we will approach it. This is typically a picture of greater palatine nerve block. Okay, as per the students recall, because they are pointing it towards the mucosa, so most of the times this is greater palatine nerve block only. Okay, and maxillary nerve block, remember, it is it is approached externally through this superior zygomatic process. So infraorbital I have already shown you, anterior ethmoidal I have already shown you. Okay, so these two are directly from anesthesia MCQs. Let us see the third question, not directly from anesthesia, but it's a typical triage situation. There are 4 patients to be taken care of. You are the doctor on the duty in the emergency room. Which of the following patients you will attend first? So this is a mix and match question from INI-CET people. So generally we know in any triage situation what is our goal whenever we are working in casualty, that is A, B, C, D, E. A for airway, B for breathing, C for circulation, D for disability, E for exposure. Right. Let us see the questions. A 60-year-old conscious male with blood-soaked trousers. Okay, no problem. He is having some amount of bleeding. It's not my priority for me to attend. Let us see the second option. 45-year-old unconscious male with noisy breathing. So this is my utmost priority. The statement itself is telling you that there is some amount of airway obstruction. And if you are not treating airway obstruction on a priority basis, there is a huge chance that you might lose the patient. So priority is always airway only. Okay, let us see the third option also. A 20-year-old anxious looking male with rapid breathing. No need of worrying because patient is anxiously looking. That means he is conscious. Rapidly breathing, no problem, nothing will happen to him, right? A 6-year-old girl who is crying inconsolably. Okay, patient is again conscious. So what is the appropriate answer? The most appropriate answer or the most accurate answer in the given options is 45-year-old unconscious with a noisy breathing. So this is a typical triage situation what we do, and most of the students, they mark it right only. So these are the 3 questions that have been asked in your INI-CET examination. Hope you have done correctly in this session. So with this, I'll conclude my session. So believe me, when you are preparing, when your journey is from MBBS to MD, make sure you enjoy this period. I know there are so many ups and downs during your preparation phase. I can understand how much amount of stress is going on. So, but don't worry, this is all part and parcel of your game. So wishing you all the very best for your future. Thank you once again. Bye.